welcome to the conversation. I'm your co-host, Alistair Sampson, and who we have with us at this time, we have Christopher Crossley, aka Mr. Crossley, sir, aka the gentleman, and of course we have Micaiah Wilson, aka Mr. Fit, aka the monster trainer himself. And we have a special guest with us tonight. As promised, we wanted to have the chat now more than ever with respect to the area of COVID-19 and to deal with the myths and the facts and everything that you're hearing about. So we have our special guest with us, Nurse Avian Drayton. How are you, Avian?
Yes,
I'm very
yes.
well. Thanks for having me.
Great, great. Good to be here. Now we
Wonderful
have a
having you.
little tradition here. Crisscross, of course, we have our COVID-19 moment. So go ahead,
Yeah.
Chris. Go strong.
All right. So good night once again. And as always, we like to start with a COVID check-in just to know how people have been during inception when it hit our shores and, dealing with it. And it's going to be interesting to hear from you, especially, how has life been for you since COVID, as a person, not in your profession, but as a person yourself, how has it affected you and how have you been dealing with it?
Um, well, as a person, it's been just as hard as the profession because I have had a few friends who would have had COVID. And so I would have known some persons. Thank God, no one I knew passed from COVID, but, you know, you interact with a lot of people. And there was a time on Facebook, I was getting fed up of only saying rest in peace when other friends were posting the deaths, of their loved ones, so there was a kind of depressed period where that seemed like all you were doing on Facebook. Every day you was writing rest in peace, accept my condolences. So I've had to personally cheer up myself, give myself that motivation to go forward because um, there is no release emotionally for most persons now. Some people, it's lime, just to go out with friends. They might, do something, but all our social norms have been cut off. So a lot of people don't have any coping mechanisms. And that's one of the things for me. I felt, that you can't just even go by your friend and lime and laugh. You have to study, So that's how it has been for me personally.
Wow. Yeah, I can imagine when you see when it's close to home, especially, you realize just how real it is. And that is actually something I want to ask you, but we'll get into that shortly. So, guys, let me just hear from you. How has it been for the last week?
You want to go first, Mike?
Yeah, no problem, man. This week has been, it, to be very honest, like we haven't been on. We missed a week. We
Missed a
were
week,
not
yes.
on
So
last
in
week.
2 weeks. Yeah, correct.
So in these last 2 weeks, I think the anticipation of what will open next and what's going to change next, and there is a sense of both being excited but yet being a bit anxious
Mhm.
about those pending changes because I mean, as much as a business owner, it is potentially good. It's also potentially an additional hazard coming forward after things begin to open up more. And so it does have been a bit of a limbo. Like in some points you are really excited, and in some
Yeah,
points you're wondering, all right, so what's the next adjustment that has to happen? And then you're also cautious that you don't want to open up too much. And
correct.
then there's a shutdown again, and you're thrown back into this state of, you know. So it's a ticklish time. But I mean, I'm really glad that we've gotten a chance to really and truly grow through the COVID period. So it's a learning process, and it's not been that bad.
Yeah, I mean, same thing here. It has been a growing experience in terms of lots of changes that have been happening. And seriously, as certain places start to open back a bit, I think we as a family are still very much cautious with respect to what it is that we bring home, what it is that we do, and I think sometime I'm realizing that really and truly this is the new norm. 2 years ago, persons would not have been washing normal groceries when they come home, or
Yeah.
putting things out by the door, making sure that everything wash out first, stripping down, going on bed, don't touch anything, keeping away your hands from the face, and a number of these different things like that. And you realize now that, look, it's so much of a pattern now. I realize that I'm just doing it just as second nature, just washing out things, and it is really a big change. And I
Yeah.
think psychologically you realize that you're doing it now without even thinking. All of
Right.
these things that people were saying it's hard to do, how you could do that, and you realize
Yeah.
it's really a new norm right now in terms of how we act and what it is that we do. And it's just really a matter of just trying to keep everybody at least home, encourage, support, to support each other and everything like that. Because I mean, it is tough on the kids as well too. I mean, for those who want
Yeah.
to go back to school and these things
Oh,
like
yeah.
that, and want to go on vacation and go by some friends. Yeah, right now, thank God for Zoom.
Indeed.
Yeah, it,
Indeed.
it reach a point like that. Yeah.
Yeah.
Yeah, I can imagine. I know some people, children actually not handling it well. Other people, children are, but
Mm-hmm.
some really aren't adjusting to the homeschooling. Some can't, don't have a way to expel that extra energy. And yes, some parents bouncing off the walls. It's just, the truth. The
Yeah.
last 2 weeks for me has just been, you know, more grinding, a lot of harvesting some seeds that I've sown over the last couple of months, seeing things starting to bear fruit, which I'm grateful for, especially during this time. So I'm just looking forward to seeing how things develop. And just as Mike said, with adjustments happening, stuff opening back from next week,
Mm-hmm.
I'm just hoping that people be responsible
Yes. Oh
individuals
my gosh, yes.
so that we can collectively move on, and get our numbers back down and everything like that. And saying that, I think that is where I actually want to start in the question, as you mentioned, Ms. Bailey, that you had family and friends that actually, you know, got it at home. What would you say to the people that still think COVID is not real?
Oh Lord, that's one of my pet peeves. I um I had a friend of mine just about a month ago, and if you go back on my Facebook post, you would see when I kind of blow up about it, because he inboxed me to ask me, so COVID really real? And I think I just tripped, because at that point in time, we were seeing hundreds of persons, and of that hundreds, 70% were positive, you
Wow.
know, and we were at a crisis. Our departments was overflowing, and my staff was coming down with it. And people still think it's a conspiracy theory, and all I asked him is that, what could possibly make every government around the world shut down all their activities, all their income generation, and actually pay people to stay home?
You
What
understand?
could possibly make a
Yeah.
government decide to tell you need to stay home and I will give you money to stay home? I mean,
Mm-hmm.
that is madness.
Yeah.
And if you
It is.
think that there's a conspiracy theory and governments just giving money to thousands, hundreds of thousands of persons just like that, there's something wrong with you. There's something wrong with you to be thinking something like that. I mean, there is no sense where that is. I can't explain anything to you with that. No government is going to do that. They have to be crazy. So that's it for me.
Oh gosh, as I had to ask because
Like
I
weight
was
on the roof.
baffled. No, dude, I was waiting to ask that question because I've been from the start, and I'm like, so people just dying because, granted, people die every day, all right,
Yeah.
outside of
We
COVID,
had over 1,000 deaths.
but not like that.
1,000.
Correct.
Yeah.
So that doesn't make any sense. But all right, so on a typical day for you as it started, give us an idea, give us a walkthrough of what your normal day has been.
So COVID started by us. That's where I work, right? Hoover Hospital and Arima Hospital and all these other facilities and stuff were not open before. So persons came into my area, into my department, and it was an unknown, right? So we would have heard about it, this new disease in China, and we would have heard about SARS before because we had SARS, right? And so for who don't know, COVID is SARS. It's a variant of SARS. So it's SARS coronavirus, and it was discovered in 2019. And that's where it got the term, SARS-CoV 2019, right? So we would have dealt with SARS before, and yes, SARS was a flu, but it was a flu that you got and you got over it. But then they said this one was different. This one is killing people just soon as there's touch and whatever. And just like everyone else, we were scared. And they were coming into us. There was, yes, we knew the signs and symptoms, but COVID is something as well that you can be asymptomatic for a good period before you start to show signs and symptoms. So we would have had so many persons who would have come through to us, was good, no issue. We deal with them, put them on a ward. 2 days later, runny nose, fever. When they check them, positive. And that was the scare factor because at that point in time, Cuba and stuff wasn't open. What they were doing is the step-down facilities where the Prime Minister and them would have put that first batch of persons and they would quarantine people in different areas. But then they started to come to us. And they were coming to us every day, all the time. And as I said, you deal with the person good, tomorrow you hear COVID. And then all the staff now who would have dealt with them had to put on quarantine. And then it was also secondary. So not only the staff, but the staff relatives and whatever. Can you think about the economy in Trinidad, how much man hours have been lost with COVID?
Wow.
Because, we have, let's say a ward has 23 staff. We have had to close the entire ward because the person might have been on the ward for 2-3 days, mixed with everybody. All the staff would have attended to them at some point in time, and then all of a sudden you get a positive result. And every single staff have to go home. And that's not just nursing personnel, that's persons in the kitchen who would bring meals. That's people who clean in the ward, the unit. That is this patient next to them, relative who did come visiting yesterday. And you need to find them and tell them. And it was a nightmare.
Contract tracing nightmare. Wow.
It was a nightmare. And then when wards are closed, you're closing it because they're sending the staff on quarantine, but you still have all the patients on the ward there.
Correct.
Now we have to find out what to do with them. So now we have to start testing all of them to see all who was mixing with the person. And Trinidadians, we are a social society. We don't stay on our bed when we just go by this one and say, so what's wrong with you? When you come, go and sit down on their bed and think when the family come and say, no, the nurse, he was calling for the nurse whole day and nobody didn't come. And you'll be mixed with everybody. And it was a nightmare. And they couldn't hire enough staff because in the end, they couldn't take from other areas. They kept trying to hire. But the more you hired, the more people were getting affected. And it was really, really, really a nightmare. I'm thankful that has decreased. It's not that it has stopped completely, because people end up turning up positive. Sometimes it's only when they're about to go for a procedure, because we don't allow patients to go for any invasive procedures such as theater or so forth without doing a test. So you find a lot of people would come simply for a routine procedure. And because we ended up testing them, then you find out that they are positive, So, but it's not as much as before. very, very thankful for that. But I must say it was very frightening when it was occurring like that, because you just staff was just going, had to be home. So I can
Yeah,
imagine people.
that initial shock of when it was happening, now learning about it, how to deal with it, and then finding out people have it. And as you said, that instant contact tracing had to happen, because
Mm-hmm.
that is
But the
one
thing
place.
is, now all staff wear their PPE from one
Yes,
time.
correct. As you're
So
coming.
we are all in PPE. So you find that even if you would have interacted with the patient now, you would have been protected.
Protected.
Right? So it's only if the healthcare worker might have been lax and felt not upon the mask at the point in time, which is few and far between, because everybody's scared and everybody's trying to protect themselves. Mm-hmm. So it isn't as bad as it was before, because everyone is wearing their PPE. And so what we would find is staff would infect staff. It's hardly a patient. Right? Because some people, remember, COVID is affecting everybody. So it might be your husband or your mother or your father who have it at home. You didn't know. Correct. You will be with them normal, but you come on work and they sit down in the lunchroom eating, and you take off your mask, you're eating, but the two of them blagging, and in that period while they're blagging and whatever thing, by evening somebody get a phone call, this person mother has it.
Cough.
Now you find out, then you had to start back with the nightmare. So that's the only little thing now. Yeah. But it isn't as before. Thank God for that.
Yes. I couldn't even imagine that. So what I want to ask now is, I know, as you mentioned, you felt for a while that you had to come off of social media because it was a lot of gloom and doom messages. Mm-hmm. And then you were there on ground zero every day, seeing people go through, from being asymptomatic to sick to very sick to near death to who recover. I want to distract from the gloom and doom part, because we know people would have gotten sick and people would have died. How did you see the transition of people that went from, let's say, intensive care to recovery? I like to shed the light on the fact that yes, people died, but a lot of people still lived. I don't think we talk about that enough. So how was that for you? Because you can say the truth. You can say, well, Chris Boy, it really wasn't so.
That's what I want to tell you.
Wow.
I don't want to call a percentage because I don't want anybody to quote me, but right. I think 80% of persons who end up in ICU die.
All
right. Because COVID is such. You see, what COVID does is that it there's fibrosis of the lungs. It hardens the lungs. And when you intubate someone, they are now dependent on the tube and the external ventilator to breathe. And if the disease wasn't caught in time, that lungs get hard and you can't get it back soft. There is no cure to get back the lungs soft. What happens is that hopefully you would have caught somebody in time, they got their treatment and so forth. But whatever fibrosis they develop, they are going to live with that for the rest of their life. So nobody is cured from COVID. You may not be positive longer, but you will definitely have signs and symptoms of COVID for the rest of your life. A lot of people, there is a new diagnosis, which is called long COVID, LONG. And it is, even though you're not positive, you're no longer positive, your body still goes through the signs and symptoms of COVID for a very long time, right? Even up till 6 weeks, 8 weeks. So these persons have constant shortness of breath because the fibrosis is still there in the lungs. You have persons, there's now post-COVID-19 psychosis. A lot of people are suffering mental conditions post-COVID. So
a form of PTSD kind of way.
Yes, that's right. It's like a PTSD. So they're still scared. They're afraid to go around other people. They become recluse. Some of them actually become psychopathic. They do crazy stuff. And a lot of patients will come in with post-COVID-19 psychosis. So COVID is not something that affects you. You get better and you're done. It is something that stays with you for more or less the rest of your life. And if you are somebody who works, it's affecting persons and their jobs because you cannot do the things that you used to do before. So if you were working in an environment that was physical, we can't send you back in a construction site because you can't with dust and you can't lift up a bag of cement and all of that. Some people can't walk too far. Some people can't stay for 8 hours working because they're tired, they're debilitated. And that is something new. So COVID doesn't just end after, it continues.
Wow. That's what you said there about the lungs. I had a good friend in England who had it. When I spoke to him, I tried to keep up with everybody internationally as it happened, and he had it for about 3 or 4 weeks. And he said, Chris, taking a breath, he said he felt like his lungs cracked every time he took a breath. And he said he wouldn't wish that on his enemy, anybody he doesn't like. So he said that pain is ridiculous, and he was just grateful to be alive.
So remember your lungs is like a balloon.
Like a steady process, yeah.
That's right, in and out. And COVID comes as though you paint a nice layer of cement, a nice thin layer of cement over this balloon, and you now, after the cement hardened, you're trying to blow the balloon. You understand? No, you have to breathe, so you have to push. So what you're doing is pushing against cement for every breath that you are taking. And after a while, it becomes tiring because breathing is something that it's automatic. There's no real control of breathing unless, you decide to take an inhale or exhale. Normally, you don't think when you're breathing, but now you have to concentrate on every single breath.
Wow, that's a lot.
The scary thing with that too is that, I think even now with you saying that, I don't know about you guys, but for me, I take a deep breath just to see, automatically you take a deep breath just to kind of check and see.
Since COVID here, bro,
right?
I test ever so often, 10 seconds, 12 seconds. Good.
The sad part is that, and the sad part is I think a lot of people, if they've ever come in contact with somebody that suffered these things, they can develop these fears and these mental conditions where it's like this.
Yeah, that is your last breath because you're putting so much effort into the breath.
Yeah.
So can you imagine
for those
time to sleep? When you sleep and you don't think about breathing.
Nope.
But now you have to stay fairly awake to breathe.
Yeah.
Sure.
Because I don't know if you guys people on a regular basis, if you were to, let's just imagine something on your hands and somebody says, don't touch your face with your hands. All of a sudden, your face begins to itch and you wanna, right?
One time.
And with the explanation you've given about how the lung is affected by COVID, which I haven't heard much people speak about, to be honest, right? I think for people who have not experienced it, with more and more information, you begin to get very conscious of what your body does, how your body feels, what you don't feel, what you do feel, what you think you're feeling, Like the other day, like for me, I have sinus problems. So the other day, that tickling in the back of the throat from the mucus, so your sinus strip started to cough. And when I get my little thermometer and check my temperature, and I was like, Mike, you have sinus problems, but still in the back of your head.
Instantly, everything.
It's like, so I can only imagine for somebody who's suffered through the actual impact of COVID and have recovered, as you would say, and still having those pains, you could definitely have a bit of a mental breakdown.
Yeah.
Just going through those feelings over and over.
That is scary by itself. That is scary. I mean, like I said, I have friends that had it and came out well, and from what they've described to me, and those were actually athletes as well, and the fact that they know for themselves that they are not 100% anymore.
That's right.
Yeah.
They actually feel it. They literally said, "I know I am not 100%." They try to run, but they still could do it because they're mentally pushing themselves past it, but it's just not the same.
It's not the same because there's no cure to fix the lungs. The lungs is already damaged. It's already hardened. So sometimes it's not the whole lungs, but just part. But the fact is you would have lost that function.
A percentage of that.
That's right.
Yeah.
Mm-hmm.
Wow.
I have a bit of a question. Now, as a conversation I was having recently, both with my wife and with some other friends, where we are speaking about the fact that there may have been a number of people that may have contracted COVID in some way, remained asymptomatic, recovered, and never really knew whether or not they had COVID. Right? Like I was telling a friend that I wouldn't be surprised, and this is me saying personally, if at some point in time I would have come in contact with COVID, right? And you would have felt flu-like symptoms, or at least one of the symptoms. And when you felt nothing else, you told yourself, well, nah, I'm good. And then as you go on and you hear more and more information about COVID and the after effects of COVID, you begin to question, did I at some point in time actually have COVID?
Yeah.
As a nurse, I haven't seen these things. Do you think that there is that possibility?
Oh yeah, for sure. I personally think I'm one. As well as most of our healthcare professionals, especially from early on when we were not aware and there was just the original COVID that wasn't as bad as now with the variants. And so I remember speaking with one of my head nurses more than once, and I'm like, we had COVID already, right? Because we would have gone through, I was on quarantine 4 times. 4 times with signs and symptoms. Supposedly, I would have been exposed to somebody, but every time I swabbed, it was negative. So it never showed COVID. But I remember, and just 3 weeks ago, I got a bad chest pain and ended up in hospital. But before I got that chest pain, whole week, I remember telling my neighbors, I feel in my lungs. And they keep asking me, what do you mean by that? I say, I don't know. Because sometimes, I could see what people, but when it's time for me, it's different.
Yeah.
And what I was feeling is like somebody pressing on my back. Oh. So I was walking around conscious of this
pressure,
pressure on my back. And I remember going to the hospital with chest pain. First they were saying, a heart attack, and then when they did an X-ray, see everybody started to move, and they were saying that I have post-COVID-19 pneumonia. Oh. So I was like, excuse who?
That's a thing.
Oh yeah. So because your lungs is damaged, it will show up on an X-ray, and my lungs definitely show that there's something wrong. And it looks, how they call, like a COVID lung, but I have never tested positive for COVID. But the fact that I was doing that, and when they did the X-ray actually showed all the opacifications and so forth. And they said, I think you had COVID. I said, well, we were kicking and saying that all the time, but now we have to really wonder, because we normally get a little cough and cold. And because of COVID, it doesn't want to talk it out too hard, because everybody only see a cough, they look at you,
Yeah.
So I really don't know when that would have happened, but the X-ray is showing something. So, plenty persons, they may not have been as lucky as I am, where I would go to the hospital because I work there and I make sure that, I get my test. So mines would show up, but plenty other persons, they're walking around and they're just fine. They're not 100%. They're not feeling like how they used to feel before.
Yeah.
And they're not aware that they might have had it.
Interesting. Wow.
One of the things I wanted to ask Avian and this may be more with yourself, your team, and the daily operations that you all have there. How are you all coping, really, within that environment itself? I mean, you're seeing it daily. You're seeing the effects of that. Personal experienced nurses, new nurses. How are you all coping and dealing with this right now, or how in terms of how this is going so far? How are you all dealing with it?
Well, we have an excellent team. Our head nurses, they are aware of the stressors of the staff.
Mm-hmm.
And what we have tried to do is create events and activities in the department, to break the stress.
Yeah.
So we celebrate everything. Everything passed, we celebrate it. So it's Eid, who bringing roti, who bringing this, just to break the monotony, to know that it's not a normal day. Today is Eid. We celebrating Eid. We know it's hard for people to come out to work on Sundays. Sometimes the head nurses and them come together and they cook lunch. So who will bring? So the staff not contributing to that, but all the head nurses come together, and we would provide lunch for the staff on a Sunday, something like that. We would have had Nurses Day on the 12th of May. We made it into a big event because we wanted to do something for the public, but because at that point in time was only 5 persons in any gathering, we just decided to celebrate amongst ourselves. So some of our staff would have had relatives who work in different companies, and they said that they would be willing to contribute and give donations to our staff, So Massey would have given us hampers. They asked us how much staff was working in our department. They provided hampers to us that day. Another company would have given us a package, and just things that staff come to work today and we say, okay, we appreciate you. You can't go nowhere, we can't do anything, but at least you're appreciated here on work. We're glad that you come out. Yeah. And another thing I tried to do was to maintain vacation leave. Even though HR would have put a ban on vacation, I really worked against it because, as I said, COVID started with us in our department from March 2020. It cannot be 2021, and I have persons who did not go on vacation since 2018, 2019, and just tell them they have to wait until the end of COVID. People are tired. They're mentally tired. Yes. Even though there is no place to go, the fact that in your bed and you don't need to get up to come to work is a relief. Yeah. Is a rejuvenator. So we would have encouraged the vacation, not too much at a time because we can't afford for the place to break down. But when people come, we say, okay, you can't get 21 days, you can't get 30 days, but I'll give you 14. 14 days, go home, relax, play with your children, come back out to work. And it has been working for us because people were stressed. And they were just able to spend some time with family, put things in order at home, and come back out to work. So that's how we've been coping.
Wow. Okay. Well, I see we have some questions that I want us to address, but I have one question I want to ask first before I get to those. So I have a friend in Miami. His wife is also working on what you call ground zero there. And he said when COVID really spiked in Miami, their relationship changed tremendously because she would come home, she would interact with the children, she would, change by the door, go in her own corner, and she would literally stay away from them for long periods, so, and it actually affected, the household in that kind of way. So in your terms, because you're in ground zero as well, how has that affected your household in that regards?
But my household is just me. So there's no...
Okay, all right.
But I do know I've had friends who were actually in ground zero, and you see, when COVID came out, people were so scared, and rightly so. But remember, it was also an unknown you were dealing with, and I would have had persons who their relatives would not allow them up the step when they come home. They have a hose and hosing them down. Now people will think, oh well, she was dealing with COVID or whatever. But can you think how that would affect someone knowing that I've been out working hard whole day fighting, trying to save people's lives. I'm tired, I'm coming home, and I'm being sprayed on with a hose. My family don't even want me in the house.
Wow.
You know? And a lot of people just felt, well, they were taking precautions. But think about that person mentally. You are making this person feel ostracized. We would have had nurses who attempted to go in the supermarket and stuff before it closed, and from the time they see them look like they had on a uniform. These are people who were not working in the hot zones. They were not allowing them in, So people had a lot of discrimination from that, and a lot of people grumbled and stuff about it. A lot of people got depressed. Some people left the job, and it has been hard on some of us mentally, because it took a while for family to get accustomed to it, to know that, all right, she's safe, she came home and she had a shower or whatever. Instead, people were not allowing the relative in the same room with them. They can't even sit down and have a little dinner and talk and say what it was, because everybody's looking at you that as soon as you talk, you'll give them COVID.
Yeah, that is wow. All right. All right. I know some homes, a lot of us adjusted and got stricter rules in terms of taking issues by the door, changing in the laundry and putting your clothes to wash one time, these kind of things. But what you mentioned there, that's a whole other level of I don't want to say it's paranoia, because I could understand somebody wanting to protect their lives in that regard. But oh gosh. Yeah, that's tough. That is really tough. So some questions we have from Miss Dates. Good night as always. Thanks for joining us. Are healthcare workers receiving any type of counseling?
So my RHA, they have sessions every Thursday, Zoom, where our resident psychiatrists and the psychiatric nurses would hold different sessions on coping with COVID, your household, and so forth. We have that. And then every Monday, we have a psychosocial session where we send staff, which I find is awesome. I attended it. I like to attend everything that my staff have to go to, so I would know the experience, and I felt it was wonderful. The nurses, the mental health nurses who conducted those sessions, really understood what we needed. And that was amazing to me, because it was a whole day session, and I was like, oh God, a whole day to just sit down. But you know what? It was interactive. We had fun and games. We had role play and so forth. And they really taught you how to cope. So I really have to give kudos to my RHA for that they have focused on the mental health of, the staff.
Wow. Okay, that's excellent. That is excellent. Yeah. And the next question, which is going to, I know, would have come up. Do you believe the public is getting adequate pro-vaccination information?
Yes, they're getting it, but are they accepting it? They are, because everywhere you turn, there are ads, there's conversations, Facebook, Twitter, Instagram, the radio. I drove to work the other day, and I heard about 8 different things about vaccinations. So the information is there, but the public still seems very, very reluctant to accept the vaccines. So there's a lot of vaccine hesitancy, simply because we have so much different reasons. A lot of people felt that, okay, but they come and develop this vaccine so fast and AIDS here all the time. They never bring no vaccine for AIDS. And all different things were here. But the thing is, as I said, nothing has really impacted economies like COVID. COVID has destroyed economies, and everything depends on money. If your government does not have money, they cannot see about the social ills, they can't fix infrastructure, they can't do anything. And as I said, there has been no other disease that I'm aware of where the government allows you to get money while you're home.
Yeah.
just so that disease. So therefore, there was a global trust to develop this vaccine because it has hit the world financially.
Yep.
It has hit the world financially, right? Because even as I said, when you go on quarantine leave, it isn't taken from your regular leave. Your pay is not deducted. The ministry did that. So when you think about it, everybody you know would have been on quarantine leave at some point in time. Do you know the cost of that to the government? The cost of that to, you all said you're a business person. So if you had staff home on quarantine, but you had to pay them, you didn't have anyone coming in, and you had to find money to pay this person because they cannot be penalized for COVID.
For COVID, yes.
Therefore, the governments were forced to put a lot of pressure for the development of the vaccines. Yeah?
Sure. And I want people listening, and I always tell people, do your own research too, right?
Yeah.
Look into the things that you want to find out about. Like, we talk about these vaccines being rushed and experimental and only got approval for whatever use. And if they check, right? I actually read this in an article recently. Polio. When the polio vaccine came out, the authority that approved vaccines didn't exist. You understand what I'm saying? It didn't exist. You could Google that and you will see. Check the years. All right. There have been vaccines out and in use before the entity, the institution that approves of these things existed to come and tell you it's good enough to take. But yet we were all taking it back then. Right. And as always, the thing with a pandemic, it doesn't just take lives, it does hamper economies, because our economy, if you know it, one man's expense is another man's income, and if everything is closed, it is not turning. Nobody is spending, so nobody is earning. Right? That is how it works, in a very simple form.
Yeah.
Right? So, the information for the vaccines are there. A lot of people will quicker look at what somebody say in a meme, or somebody who is not medically trained talk about this, banter about it, and they'll run with that before going for official information. There are many sites that put them up, So
I think a big part of that though is global distrust, right? A lack of trust between the public and persons, whether it be in power, whether it be politically, whether it be, in those positions, because I think a lot of times we've faced so many different conspiracies over so many different years that any sense of a conspiracy behind anything, people jump at the opportunity to say it's a conspiracy and there's some hidden agenda. And I mean, take for example the recent Olympics. Look at the Olympics and something that happened. I heard people talking about the conspiracy in the Olympics, and I was saying to myself, I was like, some of this is not even a conspiracy, it's simply countries that were able to keep the athletes performing, were able to do it. Those that were not. It's literally that simple, right?
No, bro.
But people will be quick to jump on the fact that somebody say that there was a conspiracy to make, like right now, I mean, we would jump so quickly at any opportunity and it's so funny how people band together on the thought of a conspiracy, as opposed to let's get together and we build our country, we build our economy, we build our population, we build the working community, there are so many different people affected by COVID. I was watching a study recently that showed that mothers, whether it be working moms or stay-at-home moms, were severely affected by COVID because their duties would have increased so much over the period of time, because you're talking about women who have their regular jobs but still have to then homeschool kids, look after them on a full-time basis while home, because a lot of mothers aren't sending kids out to daycare.
Yeah, sure.
True.
You understand?
But daycare are supposedly closed.
Supposedly.
Yeah.
So like there's so many different branches of our lives that have been affected by COVID, but yet we pose so many different blocks to whether it be the vaccine, whether it be just information about COVID, and even to the existence of COVID. I mean, up until last week, I heard a guy, I saw a guy walk into a business establishment without a mask in Trinidad, and they're saying, oh gosh, Ollie, oh gosh, oh gosh, I hope right through Lyman and talking and I get COVID yet. And I was like, brother, you cannot be serious. Saying that alone, and I lock him up now. Just lock him up.
Oh my God.
You know, so my thing is, what do you think can be done, at least locally here for our community, to encourage more people to at least look at the facts more?
The thing is, our society now, and this is not just Trinidad, this is the world. We are not like long time. Long time, we just had respect for authority, and whatever they would say, because we think that they were the authority, we would go with that. Can we blame Patrick Manning for making sure everybody had degrees, that everybody think that they're experts? So we used to have a time where we would say, well, yeah, they know what they're talking about and whatever, but we all are COVID experts. You know, we all have degrees and we all know what we're talking about. And we have a lot of conspiracy theorists, and they have a lot of other like-minded persons. So whereas before somebody would say, hey, you're talking nonsense, no. You have somebody saying, you know, that's true. And somebody's going to verify. And so that just simply builds your confidence with your narrative, right? So that is what's happening. We have too many experts who think they know more than everybody else. And people always trying to repress them. And, you know, and that is what is driving the vaccine hesitancy, because everybody thinks it's the mark of the beast. They think it's a trip. Seeing everybody with their spoon or the fork on their shoulders. They put their hands, watch, look at stick on me. And then it had those with the light bulb that they found out eventually was a different sort of light bulb. So because of how social media is so accessible to everybody, that from the time you have a theory, you could put on your live and you could start, and you are going to get an audience who believes you. Yeah. That's the fact. Right. Long time you could have been in your corner and somebody would just chips and say, you're always talking nonsense, and leave it like that. Now you can get an audience and a following. And that is one of our greatest downfalls right now. We have too many computer experts who knows more than the real experts. So not until there is basic trust. Mm-hmm. And I always say, not until COVID hits home. I had a friend, a good friend of mine, well educated. This person has held all sorts of positions in Trinidad, and she felt COVID was a conspiracy. And because their family were business persons as well, and their businesses were closed, you would always hear, Rowley, yeah, the country so, and this, that, and the other, and why they won't open up. And I would say, but she should know better than that. Why would she say something like that? And then her sister got COVID.
Wow.
And she called me morning, noon, and night, asking for updates, who I know in this hospital, who I could call and whatever. And I would say, this is the same person who did not believe in COVID. And unfortunately, the sister died. Mm-hmm. And I look at her now and I've observed the total change in approach. And I had to say, why would she have to wait for COVID to come home by her? For her to understand. There are nurses like that as well, you know. Because nurses are people in society as well. Some of them have businesses. I know one would have had a bar. Mm-hmm. And she was so mad when they closed bars early on, and they didn't care about poor people and this, that, and the other. And her father got it and died. Her mother got it and died. She got it. Mm. She didn't die. But I don't hear her talking about bars being open again. You understand? And we are a society, we like things to happen to us first before we give it any sort of credence. You know,
Lead by example.
right? Yeah,
Yeah,
that's us.
Don't
We
need that.
like to experience things firsthand.
No.
yeah.
Not that
Don't
one.
need that. We don't need that. We don't need that. And as always, I always say, and I don't care who this is. People need to read. Please. Oh gosh. It have the information there. Please stop and read. And I'll tell you how people don't read, right? Just a quick joke. A friend of mine posted, and I shared it as well. A little thing that says, I have to apologize to anyone I came in contact with within the last 14 days. You know, my family, my friends, you know, I would advise you to go and get tested as well because I have been diagnosed with being very sexy. And you should, and he said the amount of people message him to find out what's going on. And he
Because
was
they didn't read the whole thing.
he didn't read the whole, and I'm like, well, come on, just read the whole paragraph. And it wasn't a big paragraph. Because I literally just said
we
it.
read one-liners and we get the whole story from that one line.
Off the races, off to the races. And that is
Or
what
we go in the comment section. Well, I happen to be part of, you know, the comment executive. Right. Yeah. I said I have to tell myself, don't read comments because I see some of my friends, you know, Facebook will show you your friends' comment.
Oh,
and I say, nah, that can't be my friend. I'm not saying them kind of stupidity, you know. Sometimes you can't believe that people you know think so
like that,
you know. So we don't read, we find out too much. We get the story from the one-liner that's there, and then we go off on an entire tangent that's totally wrong. Yeah, we don't read, and again, we claim to be experts, but we're not reading.
Yeah.
You know what's interesting, like for me, right? And I had this discussion in the early part of this whole COVID experience. I was telling somebody that even though COVID-19 may possibly be a created disease, it's still an actual disease, right? Mm-hmm. So whatever you think the origin is, the fact is it's currently still killing people, right? Mm-hmm. That part not made up. I mean, they could tell us that it come from somebody eating our butt. They could tell us whatever. To be very honest, I no longer care what the origin was. My thing is, it's currently impacting my family, my friends, my country, the world at large. So what do we do now about that part? Because trying to figure out who's the conspiracy head on, if it's this country or that not go and save your family.
No.
Right? You being both socially responsible by not sharing nonsense, being socially responsible, and then also being personally responsible when you go out is what you need to do. And that seems to be the hardest thing for people. Like, to this day, I can't understand why. I mean, when it initially happened, and we had the lockdowns and businesses were closed, I could have understood because, like I was explaining last session, I acquired my new space the week before the last lockdown.
Right. Yeah.
So like legit went in, got people to come in and clean the space, started painting, and then they say, as of midnight tonight, we get a notice. And I was like, what? Yeah. But at that point, I understood that me defying those regulations could put my family at risk. Mm-hmm. And could then put other people's family at risk. So I chose to not be sneaky and go and do things outside of the realm, but instead, hold back and hold a string. And I looked at other people who decided that, you know what, they don't care about poor people. And I go and do my this, I go and do my that. And then those who say, I just need a little break because I go and take a little lime. And they go and have a whole bram in the back of somebody's house with 40 people.
Yes.
Who not wearing masks, drinking shots, bubbling each other. You wipe your mouth, you touch somebody else's glass, you touch the bottle, that spread around, and then you hear people dropping like flies.
True.
Then they would say, but me know what happened now, boy? And I'm like, and then they go back and say, but these gentlemen do nothing. They do their job. And I'm like, yo, but you put yourself in this position. There's only so much they can do. You know, and I think we quick to point the finger at everybody else but ourselves and our part to play in the spread of COVID in Trinidad.
Well, I totally agree with that. I can tell you that as a society, Trinidadians are very irresponsible. We are very irresponsible people. We put the blame on others. We don't take responsibility for anything. And it's very few people who are adhering to the rules and the regulations. I remember, as I said, during the first lockdown, when they closed down bars and stuff, you can't tell me I passing by a bar that black and the whole yard full with cars. And I was like, and I mean, I was going crazy at that point in time, because at that point, I think we had to be inside by 6 or 7. Trying to remember what time we had to be in, but I was working, right? And I was at 9. And at that point in time, I was living in Siparia and coming from north and coming down to Siparia. So every night I get stopped by police. Every single night. I mean, I would have my badge and whatever I would show, and they'd say, okay, go through, no problem. And I'm saying, I'm going through all of this, but I'm checking every single bar that I'm passing. It's dark, but I pass there all the time. So I must know, there are no set of people living here and cars as we park here.
Wow.
Why are all these cars parked here in the darkness? I mean, you like rum so much that you're in the dark, you know. Nonsense. These are the things that we did. And, you know, we had lines and things. I remember once I got caught up. One of my friends, her mother was celebrating her birthday. But her household has about 14 people. And they knew I was coming home from work, and they say, you want some roti? Come and you can pick up some roti to carry home and take. Hear me? I say, me I afraid to come back. Next thing Gary pass and whatever, and we were making a pics and whatever. Now this is deep south I'm talking about. Gary is supposed to be nowhere around there, any such thing. I don't think I was breaking any law, because I didn't really go to Zest. I just went by my friend to pick up some curry. I mean, with Trini, we don't pass curry, right? And I sat up there in the yard and I'm chatting and thing with them. And I tell them, I say, hurry up and give me my curry. Next thing Gary passed, and we just kicks in. And then all of a sudden, we saw something.
Blue lights.
So, and you know, these blue lights, like it just come upon you, eh? we didn't see it before. And the police cars and them pass, whoosh. Now, mind you, everybody freeze. And as they pass, whoosh, you see when they realize they have people there. And they reverse. I thought about it. That was when they now start bringing out a few moments later.
Yes.
I'm standing up there with my box of curry in my hand, because we're little old talking now. And when the car reverse, do you know it's Gary who come out?
Oh, geez, Annie. You talk about the man too much. Law of attraction.
Gary like Candyman, and they're calling him too much. He shows up.
He shows up.
Because this has to be the ultimate goat mouth. I mean,
for the curry.
The whole of Trinidad.
Wow.
There. And he come out and he's like, what's this going on here? Thank God. The neighbor across the road, he's an ex-police, and 3 of his sons were police. And they had all come over and was all about to leave with the box. So they had to go, and even in the household, one of the daughters, there's a police. And they all went to him and explained, you know, it's my mother's birthday. 14 of us live here, but she had curry, and we just asked, like, I started to act like a daughter. One time, I moved away from my car. I was like, I hold my hand will close, but I just played like I now come home from work. And all
That's
falling.
I could have died. And he said, well, all I know the rule. That time was only 5, eh? God, I know 5. All in all
Wow.
thing, you have to come down here and whatever, because that time they heard a lot of Venezuelans were coming through. There's a beach not too far, so they were going to check and whatever. Listen now, when you go on, all of them turn and watch me and they say, you have to be the most sour person. Because as soon as I reach, I was saying, supposing Gary comes, listen, I never leave somewhere so fast in my life, you know?
Up the road.
But yeah, but the thing is, you know, we all take chances and we always feel it's going to happen to us.
Yeah.
But I know them, you know, so you really have to be very, very careful.
Crazy.
And we have to be on our guard 100% of the time, not 99%, because that 1% is the one where it will expose you.
True.
So that's it. Mm-hmm.
And to Miss Smith Simon, one of our gold, I can't even see platinum, what above gold, yeah, platinum viewers.
Mm-hmm.
You know, I agree with you there, you know, that I don't know what people expect the government to do. They're doing what they can do. I would actually hate to be in any position right now dealing with this. It will be extremely difficult, but it comes down to the people. People have to be responsible individuals and just do the right thing. And just looking to wrap up, what words of wisdom would you impart on your fellow Trinbagonians dealing with COVID-19?
PG-13, please.
At this time? We could do PG-16 at least, because
don't quote the Prime Minister neither.
Oh, I need to say, listen.
you see,
Not just listen, but do the correct thing. The responsibility lies on every single one of us. Everyone. COVID is no respecter of persons. I have seen babies 5 days old, 6 days old with COVID. I have seen persons in their 90s with COVID, and then of course I've seen persons in our age group, the working population with COVID. COVID is not afraid of anybody. Your cousin have it. Your aunt have it. Your grandmother could have it too. Sometimes granny home, she's not going a single place. But the grandson who don't listen, he go in and he liming by his partner, by the girlfriend. You don't know what's happening in their household. We don't know what happens by other people. And we have seen grandchildren, children bring it home to their parents and kill them. It's as simple as that. The responsibility, the onus is on every single one of us to be responsible. There's nobody to tell you what the guidelines are any longer. Wear your mask, sanitize, keep your distance, vaccinate now, right? Vaccinate to operate. A lot of people still don't want to hear it, but it is another measure of protection. It's not a cure, right? People who have been vaccinated still get COVID, but they don't get it to that extent where it can be fatal, right? Most persons can recover from COVID, but it will affect your life later on still. It's better not to get it at all. So we just take the precautions and really be safe. Some people may think that you're being paranoid, but you have to safeguard you. Don't let your friends come in the car with you and put on your mask. You don't know what's going on home by them. You have to watch everybody as a potential. So it's just up to you. You can't depend on the government is doing what they're supposed to do. You can't blame the government when you all went and party and lime and all get COVID. That's not the government's fault.
Correct.
And Trinidad thinks so, So, as I said, it's just the onus is on us. I am saying that when the country opens up in full from next week, we can't continue living life like it's normal.
It's not.
We have to be very, very careful, because then we'll go back into another lockdown and then it affects all of us again. We really, really need to follow the guidelines. Do as much as we can. You can never do too much.
Sure.
I'll just say that. You can never do too much to protect yourself and your family. It's better you do that than you ignored it, and then your whole household ends up affected.
Yeah, well, you mentioned that little example there with the grandson XYZ, and I actually know a literal case of that. Where the grandson went to a friend's birthday party, came home, gave his father, the daughter, the mother. Mother lived, he lived, the other two died.
Yeah.
And granny now.
And can you imagine having that guilt on your shoulder for the rest of your life, knowing you were the one who caused that?
Yeah, that's not about our life, I mean, what else can people say? What else can people tell you? I know when it had a little rumor going around that it was making people impotent, I say, well, should I leave that first? Real men with us too.
I think some men bucked up from them. Yeah?
Yeah.
So, some men bucked up.
Any closing remarks, gents?
Definitely. I want to say this, and I don't think people really appreciate the work that you have been doing, Avian, and the rest of the nursing staff. I mean, on behalf of the team here, thank you for your service.
Yep.
It's like literally you going into a burning building when everybody running out. And the work that you have been doing, I mean, it seems like a thankless job, honestly, and I just want us personally tell you to thank you so much for the work that you have been doing and really encouraging your staff and really being on the front line there. We really appreciate that. We just wanted to make sure and tell you that personally.
100%.
Yeah.
Thank
Respect to that.
Agreed. Anything, Mike?
What she said.
He said it. Very good, very good. So, folks, that's it for another night here in the conversation. We do really want to thank Miss Bailey for joining us tonight, sharing her experiences and her advice on what's going on. So, as always, folks, join us again next week. And please, if you're out and about, continue to wear a mask, social distance, and wash your hands. All right? You'll see us again next week.